in order not to scare him, he said what wasn't okay, and she didn't.
Okay. So you pretty much told me the same thing that you said before we recorded. And the would make to you is that you did tell me two things. Remember, you're going to paraphrase the lecturer. In this lecture, the lecturer talks about the different forms of communication. He talked about nonverbal communication versus verbal communication. In the examples that he gave, he demonstrated that nonverbal communication, I think you're saying, I'm not sure, is as strong as verbal communication. For example,
yes,
his daughter was very young at a time, and he was working to build a case for her, and he had injured his hand by smashing it with the hammer. He did not want to upset his daughter, and for this reason, he tried to control his verbal responses, but his physical demeanor suggested otherwise, that he was in pain. The other example was an uncle had come to visit. Uncle expressed extreme joy by voice, but it was noticeable that he was very excited to be there because of his up and down movement. For this reason, determined that verbal communication and nonverbal communication, they both are effective. So that was fine. You didn't have too much of a stuttering as you said it. Now, without now tell it to me again as I listen to you.
and you want to?
It's just as if you're talking to the examiner. I don't necessarily know what you were doing when you were telling it, when recording it, but now I'm looking at you, and I'm looking for is to see if you look confident as you're speaking.
Okay. Okay. Yes, the discussion is about.
Wait.
Okay.
Hold on. You may begin.
Okay, the text is about two types of communication, which is verbal and non-verbal communication. Non-verbal communication, it's about facial expressions and body movement. Sometimes non-verbal communication act as enhancement for verbal communication. Sometimes if there is a conflict, if you want to know the real truth, non-verbal communication will give you the truth. The professor gave two examples illustrating the two types of communications. The first one, when he was visited by his uncle, he shows that he was very happy, and his body language and facial expression already said the same as he is jumping up and down. He's cheerful. So verbal and non-verbal communication are the same. Also, he gave an example when he was with his daughter. He smashed his hand by a hammer in order not to scare her or make her unhappy. He told her that he is okay. Although his facial expression and his voice is tumbling, she didn't believe that he's okay.
Okay, that was good, and that was within that 1 minute. You told me the two things. You explained them well. I could almost see it, but not completely. But I could see it, so that was good. Now tell me about the other one.
Okay. I want to see the video.
Okay. What?
Okay. Yes, the other one is just a lecture, no text at all. It's talk about. Do you want to talk in 1 minute?
Yeah, go ahead and tell it to me in 1 minute while I make my notes, and I'll listen. Go ahead. You may start.
Okay, just give me 1 second. Just 1 second to rephrase, to remember. Okay.
Okay. Well, did you record it? Is it recorded?
Yes, recorded, but just uploading.
Oh, it's still uploading. Okay, go ahead.
Okay.
Okay, so you're going to tell it to me? I'm listening. Go ahead, Shady.
Okay. The lecture is about various types of visual elements used by artists in order to give emotions or various meanings for their arts or their paintings. The professor gave example about color, texture, and shapes. Like he gave example of red color, it's a strong color. If the artist uses this color, it means that he wants to reflect toughness or anger or high emotions. While if he used blue color, he just want to say that, or just want to illustrate less emotions or some kind of smoothness. On the other hand, the professor gave examples about textures, the same like colors. The artist can use tough texture in order to give high emotions, while using smooth textures give less emotions. Also, art can combine two types of visual elements like texture and color at the same time in order to express or evoke different kinds of moods he wants to elaborate.
What's that last word? Elaborate?
Yes.
Okay. I'm not sure if you would end your sentence with elaborate because I didn't even get the word. Okay. Are you ready?
Me too. Me too.
So what I'm understanding you to say is that a painter, are there two types of people, a painter and an artist?
No, just an artist.
Okay, so an artist can use texture or colors to demonstrate emotions. Is that right?
No, it's about artist or painter or anyone can use visual elements like shapes, colors, texture.
Okay.
They use elements in order to give different meanings or different emotions for the painting.
Okay, I got it. All right, you ready for your 1 minute? I'm listening.
Again, okay. Okay, the lecture. You can say 1, 2, 3, and I will start.
Oh, I thought you'd already started. Hold on. Okay, start on the count of 3. 1, 2, 3.
Yes, the lecture is about the uses of different types of visual elements like colors, textures, and shapes. The artist can use these visual elements in order to evoke some emotions or different emotions and express different messages. Like if the artist use red color, which is a strong color, can be used to reflect anger, toughness, and high emotions, while using blue color in order to express smooth or emotions. On the other hand, painters or artists can use texture to express or to evoke different emotions or moods, like using tough textures by using wide brushes in order to express high emotions, while using smooth texture reflects smooth or less emotions. So artists can use different types of visual elements in order to deliver different messages or different emotions.
Okay. So I do get your point and your meaning. When you're using the word on the other hand, when you use the word on the other hand, you're not necessarily contrasting something else on the other hand because you're still talking about the artist. So you cannot use on the other hand, but you can say,
besides that, in addition.
In addition, yes, but not on the other hand because you're not talking about something totally different.
Yes, I realized that while talking.
So that was what I was thinking. I said, well, you're talking about an artist and a painter, you could say on the other hand. But if you're just talking about still the one person, whatever he's doing, then I think that would be different. Now, is Sarah coming today?
Let me ask her.
Okay, because your 20 minutes, this is your 20 minutes. Now we're going into Sarah or Nabula's 20 minutes.
Okay, Sarah will join right now. Yes.
Okay, so when you're talking about those things, I will walk you through it. I'll correct you. Go ahead, tell me again. the lecture or the conversation is about?
Yes, the lecture is about using different visual elements in order to evoke different emotions by the painter. For example, using colors as example, red color in order to express, I'm sorry. Sorry, I was interrupted, okay? Can I repeat again?
Mm-hmm.
Okay, the lecture was about using different visual elements by the artist in order to evoke or express different emotions or ideas. For example, using color, like red color, which is strong.
Such as, using color such as?
Using color, such as red color, which is a strong color. Artists use this.
Using color such as red. You've already said color, so you don't have to say red color. Using color such as red.
Yes. Okay, using colors such as red, which is strong color, in order to express strong emotions like fear, like toughness.
Okay, now I want you to be aware of how many times you say like. For example, such as, also.
Okay.
So you don't keep using the same word, okay? Continue from there.
Okay. While using blue color will express smooth or less emotions. In addition to that, using textures, the same like colors, to express meaning or evoke different emotions. Like you, as example, using tough, as example, as example, using tough texture will express tough emotions rather than using smooth texture.
Tough, rough. Texture isn't tough. Texture is rough.
Okay.
The emotion is tough.
Tough, yes.
Rough
okay.
Emotions, tough. I mean, rough texture, tough emotion.
Yes, yes. Using rough texture will express tough emotions and high emotions, while using smooth texture will express less emotions.
Or in contrast, you said while, but in contrast, smooth texture.
I think the same. Can we use while?
Yes, you could, but I think you use while a lot as well. But I'm not sure.
Okay.
You just have a variety of words.
Okay. I'm just used while to get rid of on the other hand.
Okay. Okay.
While using a smooth texture to express less emotions. Artists also can combine different kinds of visual elements like textures and color at the same time in order to express.
I was going to say, did you hear that like? When you go back and listen to the recording, you'll hear that you're saying like a tremendous amount of time. And you're going to be examined on your use of words that are similar or synonyms.
Yes.
Okay. All right. So now you're down to the smooth colors represent calmness or something.
Yes, calms.
Hold on. Edwin, where's the wedding? Are you late for the wedding? When is the wedding? Oh, okay. I'm in a class. I'll have to call you back. Bye. Okay. My son had left to go to a wedding. That was why I came here. And I'm like, well, why is he not? It's tomorrow. But that's fine. Okay, go ahead. Hey, Sarah.
Okay, enjoy. Okay, I'm fine. Thank you. I have to leave right now.
All right. I'll listen at send me another recording of it without the excessive while and likes, and try to find some words. Okay?
Okay, I'll do. Bye-bye.
Okay, and I want to encourage you to send me as much information because Monday is your last day.
Okay.
Okay. Sarah. Hey, Sarah.
Hi, Doc. How are you?
I'm good. I'm good.
I like your necktie.
Actually, what it is fun.
Oh,
It's my mask.
yes, it's double use.
Yeah, thank you. So do you know if Nabila is coming today?
I'm not. I don't have an idea because
Okay.
there is Muslim Eid and Muslim celebration, and maybe she isn't available.
Okay.
So okay,
Okay.
I wanted to do a case number 49.
Case 49. Okay. Mm, and tell me
I will be
what is it about? Read your task for me while I look for it.
actually I will practice a new card for me. Like exam, so I will read it first as a doctor, and you can play the patient role. Is that okay?
Yes. Will it be 49?
Uh, yes, 49.
Okay. For card 49. Okay. Mm. Have you read your task yet, Sarah?
Sorry, doc.
Have you read your task yet? Do you know what your task is now?
Yes, last task. I'm reading last task.
Okay, let me know when you're ready.
Okay. Okay, doctor. I
Okay,
can start.
so tell me what are the tasks first. Tell me what your
Yes. I think you should read the patient
no,
card.
I want you to, okay, but I want you to tell me what your tasks are.
Okay, doctor, it's talking about 8-year-old male, and his parent was his parent, the parent of an 8-year-old male, complaining of extra weight and height measurements,
Mhm.
and he is asking about the reasons and what is the next step.
Okay, so I want you to be sure that we know what your questions are that you're supposed to be asking. Just a second. That was a doctor. This is the clinic. Control. New. Copy. right, Sarah, let me know when you can see my screen.
Okay.
Okay, do you see the screen?
Yes.
And let's see. The doctor is asking about the anxiety of the son's growth. You think there must be a problem? Is that right? When asked, do you see? Is that the card?
Yes, that's the case. Yes, that's the card.
Okay. Hold on. Okay, so we know that I noticed from your chart that this is the doctor up here. Copy. Okay, so I'm listening to you. Tell me, you are concerned about your son's something. You're concerned about
Yes, exactly.
I'm going
Yes.
to be the doctor. I'm looking for
No,
my.
I suggest to.
Go ahead.
Actually, I have read the part of the doctor, the card of the doctor, and please try to be the patient.
Okay. All right. I'm going to be the patient, and but I lost blood. Setting medical care. Look like I copied the carrier twice, which is fine, which is what I am. Okay. So have I met you before? It's going a lot faster. So we have not met before.
No.
Okay. So you will start. You will always start.
Okay. Should I start now?
Yes, you should start now.
Okay. Hello, I'm Dr. Sarah. I will be the treating physician today. It's very nice to meet you.
It's nice to meet you too, Dr. Sarah. My name is Priscilla.
Oh, thanks for coming, Miss Priscilla. I'm looking at your chart and I can see that you are here today because a problem with your son. That's right.
Yes, and I wouldn't say that it is a problem with my son. I'm concerned, because if it's a problem, I'm just concerned. Yes, I'm concerned that my son isn't growing as fast as his classmates. He seems so small.
Oh, so this is smallest son?
Yes, I'm concerned that he's not growing like other children in his class. And my other son, he hasn't even reached the height of my son that was his age, of his older brother at that time.
Okay, Ms. Priscilla, thanks for sharing this valuable information. I totally understand your concerns, and I'm a mother, and I know it's normal to feel like this way, but I want to tell you, it doesn't mean that his older brothers were shorter or there are some variations between children each other. Is that clear so far? So at this point, maybe what you are experiencing of your child case, it's normal, and there's no underlying problem. It could be normal to have 19th percentile range. So there is some difference between his brothers.
Mm-hmm. Okay, so Sarah, when you asked me, did I understand? You didn't wait for me to give you an answer. So you might want to not ask me if I have any questions, and you could just phrase it and say, I want to share some information with you about percentile growth. And then,
okay.
And if I don't say anything, you continue to talk. Or if you ask me if I want to hear more, you need to wait for me to give you a response. Okay?
Okay.
Okay. So yes, doctor, I'm very concerned. I know I've read the charts about percentile and things like that, but what I know is my children are normal. Is my son normal or not?
Well, thanks for sharing, Miss. I can understand your worries, but I want to assure you that your son may need further investigations to check that everything is good. It doesn't. It's not. It is not definite to become normal at this time, but we can run some blood tests and I suggest that according to his symptoms and what you told me, I think he is maybe suffering from a condition known as precocious puberty, and this is a case in which there are high level of hormones that cause growth spurts.
Mhm.
So at this time, I can tell you if it is normal or not,
Mhm.
but we still need to do confirmation.
Okay, so one of the things that I just noticed that this is the medical clinic. I'm not necessarily sure that, but I don't think that I'm just thinking that you're not going to take any blood tests. You should be referring me to a specialist.
What okay, what I wanted to tell you that I should tell him what is the next step, whatever it is. I will refer here, or do you know, I mean that we need to run,
But
not in my clinic.
okay, and that's
It
right.
is for the next steps.
Right. So I think the next step would be, uh, I want to assure you, Miss Priscilla, that there is a measurement for children. And although your son may be taller than his older brother, he is still in the 90th percentile, which is normal for his age group. However, I'd like to tell you about the benefit of seeing a specialist. A specialist would be able to tell you more specifically about growth spurts and things like that. Now, I didn't look at the doctor's thing, but let me look. Go ahead. What is it that you want to say?
Oh, okay. And at this time, Miss Priscilla, I recommend you to that your son see a specialist called pediatric endocrinologist, who is a person who had a specialty in endocrinology. So he will be the person who who the person who will be able to answer your concerns about the condition of your son.
Mm-hmm. And what type doctor is this that you are referring?
Yes, it is pediatric endocrinologist. It
Okay.
is related to check his hormones and his glands function. So I mean, Miss Priscilla, now I know this is a sensitive age for him. He wants to feel normal like his peers, but I hopefully, if you follow my advice and try to see this pediatric endocrinologist,
Mm-hmm.
this will be good a choice for him, because there is many conditions can occur for him at this age. He is liable to get gigantism, or which is excess growth hormone, or pituitary adenomas, which is related to a large gland in his brain which secretes hormones. So it could surgically removed. There are many possibilities,
Okay. So
and
I don't think that you should. That is not your scope. You should just refer me to the specialist, the pediatric endocrinologist. So I'm going to set the timer for 5 minutes. Let me be the doctor and listen carefully to how I'm going to show empathy to what you say. All right, you ready?
just a second, doctor.
Let me send a note to Nebula.
Yes, doctor, I'm here.
Okay, let me just see. Nebula, will you be joining us today? If so, you need to join now. Okay. And now let me go back to my card. I've got to find my card. Here. Medical care. Here. Where's the doctor at? Okay. I'm looking for my card. Title. That's secure. Care. Where the doctor is. Well, did I delete the doctor? I have to just open it up again. What page, what number is it again, please? 59?
Yes, and 49.
49. Sarah. Why is it not opening? Okay, so 49. All right, do you see the screen, Sarah?
Yes.
All right, so hello, I'm Dr. Priscilla. How are you today?
I'm good. How are you? I am Mary.
Hey, Mary, thanks so much for coming in today. Look, let me set my timer for 5 minutes. Looking at your chart, Mary, I see that you're concerned about your 8-year-old son. Is that right?
Yes, that's right.
Okay, so tell me a little bit about your concerns today.
Well, doctor, my younger child is 19th percentile. He has maybe he has a growth disorder, and his older brother had not reached that height by the same age.
Mm-hmm.
So, and his weight and height and weight is 19th percentile, and I'm really worried about him.
Okay. Well, let me reassure you that being in the 90th percentile range is not necessarily a problem. So may I ask you, how tall were you and his father when you were his age? Were you tall, or do you remember?
Yes, his father was tall. Yes, that's right.
Mm-hmm. And what about you? Did you consider yourself tall at that age or average?
No, that's not my case.
Okay. So what I think may be going on with your son at this time, however, I'm not sure. I am going to suggest that we refer you to the pediatrician in the chronologist. But what it may be that your son may be experiencing precocious puberty, which means that he has a high level of hormones that can cause growth spurts.
Oh, really? Is it dangerous?
No, it's not dangerous. And this is why I want to refer you to the pediatrician endocrinologist. This type of doctor would be able to explain the possibility of gigantism. And that to me seems to be your concern, that he is growing at an excessive rate. And we want to be sure that someone is going to be able to document his growth.
Oh, that's I'm really concerned that is it will be permanent. I don't know if it is. I really confused about that because if it's normal, what is the need for the doctor?
Well, this is what I don't know. I do not know if it's normal or not. I'm just saying that your son at this present moment, at the age that he is in the normal percentile. So if you believe that he is growing excessively compared to other members of the family and his father and your growth, it is better to refer him to a pediatric endocrinologist specialist. This specialist will be able to give you more detailed information about the growth. One of the reasons I'm suggesting that you see the pediatrician endocrinologist is because of your concern about the excessive growth that your son is experiencing.
Oh, and what about his school and playing? He is able to have a normal lifestyle.
Miss Mary, as it is as of today, nothing should be changed. I am strongly suggesting that you schedule an appointment with the pediatric endocrinologist. That is the type of person that specializes in hormonal growth in children.
Okay, doctor, I can see.
Okay, so once you do that, I'd like for you to schedule that appointment. And I'm not sure if you're supposed to come back and see me again. It doesn't say that you're supposed to come back and see me. But once you schedule that appointment and meet with those specialists, I'm sure they will be able to answer any questions that you have. The questions that you're asking me today, please be sure to ask the doctors those questions. Okay, so let's stop there. So there, Sarah, you have the information. When I ask you something about medicine, you need to refer me back to going to the pediatric endocrinologist.
Yes.
These are people that specialize in this area. Okay, now let me hear you. Now that was the 5. We finished in 4 minutes and 42 seconds. Now I'll be the patient.
Okay.
You be the doctor. 5 minutes. And I'm setting the timer.
Hello. Hello, I'm Dr. Sarah. I will be the treating physician today. It's very nice to meet you.
It's nice to meet you too, Dr. Sarah. My name is Priscilla.
Hi, Priscilla. Thanks for coming in today. I'm looking at your chart and I can see that you are here today because you have concerns related to your son.
Yes, Adam. He's 8 years old and he's growing so fast out of his clothes and everything. The other concern is that he's so much bigger or taller than his classmates. And my oldest son, he's already surpassed him in height.
Okay, let me ask you a question. Is there anybody else in your family has the same condition?
No, my oldest son grew at a normal rate. No,
So
he's growing along.
you want to tell me that your younger child has you have a concern that he has a growth disorder, that's right?
Yes, I want to know, does he have a growth disorder that I should be concerned about?
Okay, thanks for sharing this valuable information. I know this is uncomfortable to see your child not like his brother, but it doesn't mean that he should have the same rate of growth. There's some variation, but Miss Priscilla, what I wanted to tell you that I reassure you, being 19th percentile range is not necessarily a problem, okay, and it could be normal. But as you believe that he had extra growth rate, we should take this as a consideration.
at this moment, I wanted to ask you, what about you and his father? Are you tall?
Okay. No, I'm not tall for my height, but I want to tell you, Sarah, you already asked me that. You asked me that earlier. See, I clicked off what you've already asked me. What you need to tell me now is about these things. So let's go.
Mhm.
Let's start again. Sarah, do you see where the doctor is? The doctor's thing down the bottom?
Yes,
Okay.
I just finished the second task and moving to the third one.
Mhm. But I want you to remember, keep this in mind, Sarah, that the questions may not come in the order of the tasks. So you just have to know that these are the things that you want to ask. So you had already asked me about you said, does anyone in my family have any problems with their height? That would include his dad, that would include me and his brother. So you've already asked me that. Okay, let's start again. And
Okay.
I'll try to mark them off as I hear your answer.
You mean, doctor, that I should ask this? If I would like to ask this question, it should be first. That's right.
No, no, no. No, I'm not saying it should be first. I'm just saying that you've already asked me. You already asked me that question at the beginning.
Mm.
You asked me about anyone in my family. You did not ask me exactly
Okay.
the same way, but you've already.
Yes. Yes. Actually, okay. It's fine.
Okay.
So, okay,
Okay.
let's start.
Again, I'm setting the timer now. 5 minutes. You may begin.
Hello, I'm Dr. Sarah. I will be the treating physician today. It's very nice to meet you.
It's nice to meet you too, Dr. Sarah. My name is Priscilla.
Hi, Priscilla. Thanks for coming in today. I'm looking at your chart and I can see that you are here today because you have concerns about your younger child. That's right?
Yes, I'm so concerned about Jason. Jason is so tall. He's taller than any classmates. He's taller than his brother. He's even taller than his brother, who is older than he is.
Oh, I can see he is 8-year-old male. That's right?
Yes, yes, he's an 8-year-old male. That's correct.
Oh, okay, I can understand it's normal to feel like this way, Miss Priscilla, but let me reassure you that your son condition as being in the 19th percentile range is not necessarily a problem. It's just normal variation. Okay.
And that word is 90th, 90th,
90th percentile range is not necessarily a problem. It is just a variation.
Oh, really? Well, it just seems
Yes.
so unnormal, uncommon for him. And he seems so awkward as well.
Oh, I can see and understand your worries, Ms. Priscilla, but let me ask you a question. Is there anybody in your family has the same condition?
No, we've never experienced this at all in my family. No one.
So that's good. And now let me ask you, so let me explain this for you, Ms. Priscilla. I believe that your son may have a condition known as precocious puberty. That's because you are believing that he has a problem with his growth. But I'm not sure, and this is one of many possibilities. It could be also just a growth spurt.
Well,
At this time,
I don't think he has a precocious puberty. That sounds so very serious.
well, Ms. Priscilla, I can understand, but precocious puberty, it is a treatable disease and not serious because it's a high level of hormones that causes growth spurt. And I strongly recommend you at this time to see pediatric endocrinologist. I will refer you to endocrinologist, a pediatric endocrinologist, because he will the person who is able to help your son.
Well, why can't you tell me what's wrong with him? Why can't you tell me?
Oh, at this time, Ms. Priscilla, I'm not able to tell you what is going with him, but what I want to tell you that's 19th percentile, it's normal, it is quite common, but as you have noticed, it rapidly changes in his weight and tall.
Mhm.
I can take your observations as a consideration. You should see a pediatric endocrinologist at this time. He
Mhm.
will run some blood tests and maybe imaging, and he will able to know what's going on.
Okay. All right. So, well, how soon will I get an answer from the pediatric endocrinologist? You don't know. That was
Okay, Mr.
we discussed with the pediatrician.
Okay, I don't know, maybe Miss Priscilla, but Mr. Pediatric endocrinologist, he is a type of specialty who is able to discuss with you the treatment options of your son, and maybe if he needs a surgery or can rule out or rule in a condition like gigantism,
Okay. So,
giga-
okay,
gigantism.
gigantism. So, Sarah, you want to stay away from what the doctor might do, whether he's going to give me a surgery, whether he's going to give me a medicine. All that you can do is save all of these questions that you're asking and ask these questions of the pediatrician when you, these are great questions, Priscilla. And I want to encourage you to ask the pediatrician all of these questions that you have concerns about. Okay. Try not to answer any questions about, I might need surgery, I might need whatever I might need. You may know the answer, but that's not your specialty. He's at the clinic now. And when,
Yes, doctor. Okay, I'm trying to do that.
yeah, okay. But that was better. That was better. Okay.
Yes, that's
Okay.
right. Thank you.
I don't know that Nebula's coming. Let's try once more and then that will be the end for today. Hello, Dr. Sarah. I'm here about my age, but you know, of course, you would be speaking first. I'm so concerned that Jason is so tall. He's taller than any of the students in his class, and he's taller than his older brother.
Yeah,
I can understand.
I should answer.
Yes, I can understand your concerns, Priscilla.
I can understand your concerns, Priscilla. That must have been unusual for you. Is there someone has the same condition?
No, is there anyone in your family with a similar condition?
Is there is there anyone with a
In-
similar condition in your family?
No, no. My husband was normal height at this age. I was normal height. All of our children were normal height. I'm just concerned about Jason. And Jason is in the 90th percentile. Then you should tell me that's
Well,
normal for this
let
age.
me let me assure you, Miss Priscilla, that's being 19th percentile of weight
90th,
and height,
90th, 90th.
90th percentile in weight or and the height for your son, it's quite common condition and it's just normal variation. So you don't worry, as it doesn't mean that your older brother didn't have the same condition that his brother should be. So you shouldn't be alarmed at all.
Mhm.
But what I strongly recommend you now to see a pediatric endocrinologist. I will refer you to a pediatric endocrinologist
Why?
because
Why?
yes, that's a great question. Although it's a normal variation, but as you believe that there's extra growth in weight and height, I I'm thinking that your son may be suffering from a condition known as precocious puberty. It is high levels of hormones that causes growth spurt. So let's rule out this condition by if I refer you to a pediatric endocrinologist. Is
Well,
that clear?
no, I've never heard of precocious puberty. That sounds scary. Is he going to be a giant?
Thanks. That's a great question. Let me explain. This condition, precocious puberty, is a condition in which high levels of hormones causing growth spurt. So it is one of the many causes that cause this condition.
Mhm.
And I want to add at this time, it is a treatable disease and easily manageable. It is quite common condition.
No,
And
no,
I
no,
strong,
no.
oh,
It's not common. It's not a common disease. That is not a
okay.
common, and your card doesn't say.
Okay, okay, Miss Priscilla, I can understand. I think the I am sure that pediatric endocrinologist will be the person who will be able to give
Answer.
you the good responses about this disease at
Mhm.
this time.
Right. So don't tell me that it's not it's harmless, because that isn't true. Just say that the appointment with the pediatrician endocrinologist can explain more. And I want to encourage you to ask the endocrinologist all of these questions, write them down so that you won't forget them. But you're asking great questions. Do you understand, Priscilla? Okay, so I should take all of my questions to the endocrinologist. Yes, that's right. Okay. Okay.
Okay.
All right, Sarah. Next Monday is our last class. Try to get your questions in. I will answer them. And I'll be traveling on Monday. I may have to call and say I'm not home yet, but I should be home. But I might not. I plan to leave tomorrow, sometime tomorrow, going back to my house. But if my son isn't back, I may not get back. So I don't know yet. But either way, you have one more class. Just try to ask me all of the questions that you have. Okay?
Okay, doctor. Have a good day.
Okay, you too. Take care.
Bye.
Bye.
Bye.